At the Science Center, we believe that no healthcare solution can stand alone. True transformation requires collaboration across payers, providers, patients, clinicians, government, and innovators to tackle systemic challenges and create sustainable, resilient systems that really can deliver impact. That's why we've brought everyone together tonight, and I've invited these outstanding leaders to share their insights with us tonight.
The advances are amazing, whether it's AI or even the GLP medications that can really eradicate the obesity, which is a big cost for our population. The technology that's out there, the connectability that's out there, is so much at our fingertips. We just got to find a way to bring it all together and make huge impact in the right direction.
There is and has been a huge change in government, and we don't know what the results are going to be, just like we didn't know what would happen with the pandemic. The pandemic came, and it was terrible, it was dreadful, it was difficult, health inequities increased, but there were some silver linings. And I can tell you one silver lining here in Pennsylvania, from my perspective, is that we were working at AARP and with NGOs to pass the law that would ensure that insurers paid for telehealth.
When I'm reviewing proposals, when I'm talking to people, I can often poke holes into their understanding of the problem. Whether it's on the regulation piece, the payer piece. Something may work in Philadelphia, but it's not going to work in Miami, it's not going to work in San Francisco. The more that you understand the problem, the easier it is going to be to find that technology solution. I think what I see is an overemphasis sometimes on the tech piece and not going back to the root of the problem.
Leaning on the fact, when I was a pediatrician practicing, our members are very confused. As a provider at that time, there was no way for me to give the medications to the member directly. And so as a payer, I needed a solution. I would have loved somebody to say, hey, Dr. Higgins, we have this program, but I had to develop this PICS system for the practices. Right now, almost all the major pediatric offices in this area have this PICS system at this time.
Thank you for joining us tonight. This is not the one and done kind of conversation. It's really the start of an ongoing dialogue.